The question is, a surgeon excises a portion of the liver to the left of the attachment of the falciform ligament. The segments that have been resected are: option 1 is 1 and 4A, option 2 is 1 and 4B, option 3 is 2 and 3, and option 4 is 1 and 3. So dear doctor, here what you need to understand is, the question is testing of Couinaud's classification. So the Roman letters, the segments indicate Couinaud's classification. There is one more classification called bismuth classification, which actually classifies the segment 4 of liver into 4A and 4B. So this part is not important, but what you need to understand is, whenever we talk about liver in anatomy, the gross anatomy part, we consider only two lobes of the liver. That is, we have a wedge-shaped liver which is actually separated by a falciform ligament, right? And this falciform ligament divides liver into smaller left lobe and a large right lobe. So right lobe corresponds to 5/6, left lobe corresponds to 1/6 of the total area or volume of the liver. Now, when you look at the Roman letters, these indicates Couinaud's classification. So to answer this, you need to understand what is Couinaud's classification. In regular classification, falciform ligament is the one which is helping in dividing the liver into right and left lobes, as we already discussed. Whereas, when it comes to Couinaud's classification, the division of liver into different segments, is actually aided by hepatic veins. So with the help of 3 hepatic veins, the liver is divided into 8 segments. So how many segments are there in Couinaud's classification? There are total 8. You can see here 1, 2, 3. Here is the 4, 5, 6, 7, 8. So there are 8 segments with this. Okay. And what is that? It is dividing right hepatic vein, middle hepatic vein, and left hepatic vein are the 3 veins which are dividing these into 8 segments. Next important point when it comes to Couinaud's segmentation is, we got a line called Cantlie's line. Very important MCQ. What is this Cantlie's line? Cantlie's line is actually formed by middle hepatic vein. Okay, and this line actually extends. This line extends from middle of gallbladder fossa, to IVC, inferior vena cava. See, here I am drawing the gross anatomy of the liver from anterior side. Okay, here is the gallbladder fossa. Okay, let us look at the inferior part of the liver again. So when you look at the inferior part, if this is the gallbladder fossa and this is IVC, the Cantlie's line extends from gallbladder fossa anteriorly to the IVC, which is present posteriorly. So this is the anterior part and this is posterior part. What is the importance of this Cantlie's line? This Cantlie's line actually divides the liver into, this is functional division, this is not anatomical division. This Cantlie's line divides liver into left lobe and right lobe. And when you look at this, we have a falciform ligament here actually, which is anatomical division. Now, when you look at the segments, this is segment 2, this is segment 3, and to the right of the falciform ligament and to the left of the Cantlie's line, we have segment 4A and segment 4B. When you look from the front, it is actually segment 5 and segment 8 which are to the most right. Okay, so the most right side of the liver contains segment 5 and segment 8. Most left side we have segment 2 and segment 3. So what are all the total segments? You see, segment 1 is actually not present on the frontal view. It is actually caudate lobe of the liver which forms segment 1. It is present posteriorly. What is the importance of this segmentation? Whenever a surgeon performs a surgery on a liver, it is easy to remove these segments without causing much damage. The reason is, each Couinaud segment is an independent vascular segment. That means it has its own blood supply. It has its own hepatic artery. It has its own portal vein and it has its own bile duct. So these segments can easily be removed. Okay, at the periphery they are connected by these 3 hepatic veins, right hepatic, middle hepatic and left hepatic veins. So it becomes easy for a surgeon when he considers this functional classification, that is Couinaud's classification, while doing surgeries. So as we are discussing about the liver surgeries, let me give you what are all the segments which are removed in named surgeries like this. So when it comes to right hepatectomy, so the right sided segments, what are the right sided segments in the image? Most right is 5 and 8, and somewhat right and posterior is 6 and 7. So these are the 4 segments which are removed in right hepatectomy. Segment 1 is caudate lobe, which is actually the most posterior part. This is included either in right or left depending upon the priority, okay, and surgeon's choice. When it comes to extended right hepatectomy, along with 5, 6, 7 and 8, the segment 4 is also involved. So this is extended right hepatectomy. Left hepatectomy includes the surgical resection of segment 2 and 3, which are present to the most left sided part. Along with that, segment 4 is involved. In extended left hepatectomy, we remove 2, 3, 4 and we also include the right sided parts, that is segment 5 and segment 8. So let us solve this question now again. A surgeon excises a portion of the liver to the left of the attachment of the falciform ligament. The segments that have been resected are. So as we already know, when you look at the frontal plane, falciform ligament, we have segment 2, segment 3 here, segment 4A, segment 4B here, and to the most right we have segment 5 and segment 8. These are numbered in a clockwise manner. So now you see, to the left of the falciform ligament, what are all the segments we have? Segment 2 and 3. So the answer for this question is option 3, that is 2 and 3 are resected.